Hi everyone, my name is Pablo Maturana and I would like to present my recent project in effectivity connectivity of the locus coeruleus in patients with late life major depressive disorder or mild cognitive impairment. This work was carried out in the Barcelona University. I would like to present the aims. We estimate the longitudinal change in the brain structure during 2 years. Following a longitudinal voxel-based morphometry and BBM protocol. And then we analyze the difference of the effectivity connectivity with this area with the locus coeruleus. And then we analyze this data using parametric empirical bias on PIP. Here we have 3 different groups with the number of the patient and the sex and male. And I have here a picture of the Belviche Hospital because all the subjects from the clinical group were consecutively required from the Psychiatry and Neurology Department of the Belviche University Hospital here in Barcelona, Spain. And to build a DCM, we need to define the node. And these were obtained from the BBM analysis. Another group was defined from the locus mask. From the first group, we have here 3 different areas: the visual association cortex, the precuneus, and parahippocampal cortex. This area have a decrease in comparison between control versus patient. Another group from the locus coeruleus, we use a mask to define the different coordinate. We have here an image, we have here the coordinate. In this program is a good program because allow to make a semi-automatic technique to define the rostral and caudal area. In addition, we have other structure is the amygdala because have a connection with the locus coeruleus in many studies. The coordinate with the amygdala we obtain from the neurosynth. I have here the model with all the nodes: 4 nodes from the locus coeruleus, 3 nodes from the BBM analyze, and the amygdala from the literature from the neurosyntax. All the nodes have connection with all the area, so it's a full model connected. We use the data from the resonance state, so this is a spectral DCM. The difference with the normal DCM is that in this case we change or we're replacing the original time series for the second order studies, in this case cross spectrum. The advantage if doing this is that the problem of estimate the high neural state disappears and is replaced by the problem of estimate the spectral density of the neural fluctuation. I have here a spectral density from the signal of ball in different areas from the different nodes. So this is a preliminary result, but I would like to remark 3, maybe the most important. We observed 3 regions of significant volume decrease at the follow-up in patients with MCI and the visual association and parahippocampal cortices and the precuneus. In effectivity connectivity analysis, we observed a decreased connectivity from the locus coeruleus to amygdala in 3 groups of participants. No difference were observed by effective connectivity and locus coeruleus to other brain areas or across the study groups. And finally, the conclusion, we observed a decrease in effective connectivity of the locus coeruleus to amygdala in 2-year follow-up assessment, suggesting the noradrenergic input to the amygdala decrease with age. And finally, maybe this case is a not pathological, maybe it's a physiological problem, but I don't know, maybe it's a hypothesis. And finally, the gray matter volume decrease observed in different cortical regions in patients with an MCI during the same period. And this is all. Thank you.